Thank you very much. I want to start with a few thank yous. The first is to the person who is responsible for my being here today, which is U.S. Census Director Robert Groves. He really was mortified that he couldn't be here, and there are a few people here who I think know Bob and probably know that in fact he would be mortified to not live up to a commitment. But unfortunately the shutdown intervened, or almost shutdown intervened. But he certainly sent his greetings and his congratulations to the Williams Institute on the 10th anniversary. And I'll talk a little bit about some of the ways in which, as Census Director, Dr. Groves has been really moving the Bureau along in thinking about data quality issues around same-sex couples. Two other people I'd like to thank. One is Lee Badgett, and not just for the wonderful introduction. As Lee says, our interactions began very, very early in my kind of researcher career. I've had multiple careers, if any of you. Not only am I in multiple journals, but I have been a software engineer, almost a priest, and now this. So, so that kind of thing sort of runs in my background. But Lee is someone who very early on in the research career I became aware of, and what I quickly began to understand is the level to which Lee really is a pioneer, particularly in the field of economics. She was someone who decided this was the work she's interested in, and if organizations that I go around to don't find this interesting, I will just find another organization that does. And she has built a remarkable career and is, in my opinion, an inspiration to students and a model to say, you know, you really can, if you do what you're passionate about, you can succeed. And so I thank her very much, both for introduction and for that role in my life. And the third person I'd like to thank before I get into this is my current sort of co-author around most of my census stuff, and that's Mike Steinberger. Mike is who I think is in the back somewhere. Mike is a newly tenured economics professor at Pomona College. Mike came to the Williams Institute about three years ago, I think, as he was on sabbatical from Pomona and came and served as one of our public policy fellows for a year, and he really liked it. So he had this interesting strategy. He kind of just decided to just stay and figured perhaps no one would notice that that he's still there. And in fact, you know, 3 years later, when you walk in the office, there's Mike, and no one has really questioned that. So, but Mike has been a great colleague, and he's really been incredibly helpful in a lot of the work that we're now doing with the census, again, to improve the quality and validity of the data on same-sex couples. So I just wanted to acknowledge him. So as Lee mentioned, this topic is going to be a little bit different than, and this was partly for my own interest, to do something a little different than I normally talk about, which is to talk a little bit about the politics and some of the behind this effort to get LGBT inclusion within data sources. So, I'm going to start with the kind of antagonist here. And so why should we not collect LGBT data? And I'll start with, I'll get into this a little later, but for those of you who don't know, 2 days ago I came out with a research brief in which I made an estimate of the size of the LGBT community, about 9 million Americans, 3.8% of the population. I'm going to talk about that more later. But the reaction to that has been, in short, complicated. And as I often tell people about the work at the Williams Institute, at least my work at the Williams Institute, I get questions all the time about, well, do you get a lot of pushback from conservative people, from, quote, the opposition? And the truth is, no. Almost all of the opposition I get to my work is from the LGBT community, almost exclusively. And here's an example, and there's an element of folks who are really uncomfortable with counting LGBT people. They believe it's just really hard. It's really complicated. They're very worried about, what are you doing with people in the closet, and what does this mean, and what do these numbers mean? And so this quote from a recent critic of mine, Alex Blaze, who's an editor at a gay blog site called Billerico, he says, in referring to kind of how there's all these dimensions of sexual orientation and gender identity, a study that just asks people will produce numbers in the end. The numbers will be useless, but they'll be numbers. And what he's reflecting is this sense that it's just, you can't ever capture this. And, I can have lots of responses to that, but there is this sense, not only among him, but also people who do surveys, that, this is just, it's too hard, and it's not, and whatever you get is so there's so many caveats and whatever, that it's not useful. Another thing is that, which is related to that, is this idea that the questions are just too sensitive. And so people would get really nervous about answering questions about their sexual orientation or gender identity or sexual behaviors, and they'll produce large non-response, so very few people will answer, or even worse, they'll just terminate the survey and sort of mess up other results. And then a third thing that I hear, well, actually that is an unspoken factor when I talk to these survey administrators, is that it's just too politically volatile. Like, no one is really willing to be the one who jumps first in terms of asking these questions on their survey. And, and the truth is, there's some validity to that. We talked a little bit, I think, yesterday about the historic attacks on federally funded sexuality and LGBT-related research. Lee mentioned the work I did with Lowell Taylor and my other advisors, Dan Black and Seth Sanders. That was on the first major NIH grant to fund and support analysis of demographics of the LGBT population. And as part of that, and that was one of the grants that was targeted by the Traditional Values Coalition at the time, and we were on the the coveted blacklist for that. So that has put a very toxic environment around people who don't want their surveys subject to that kind of scrutiny, and there's continues to be a genuine nervousness. So what's my response to those things? Why should we collect the data? Well, the first is, LGBT people's lives are being debated everywhere. And if we can't, whether it's health disparities, relationship recognition, families, discrimination, youth, education, there's a whole host of these issues. And the truth is, in our world, if we can't enumerate these people, you can't inform these debates in a very meaningful way. You wind up relying, in my view, too heavily on anecdotes. And that's not to say that there's not really, really good research that can be done that's qualitative research, and those are really important things. But the other reality of our world is that it's important that be also accompanied by these kind of population-based studies that allow you to make at least some assertion that this is true of the LGBT population, not just of the group that I happen to study. A second is the need for increased visibility. If we don't ask these questions, so I have an op-ed that's appearing tomorrow in the Washington Post, and my conclusion is, if you're not being counted, you don't count. And in a political sense, if we're not made visible on these surveys, it's very easy for politicians to say we don't exist, and for policymakers. And so I think there's a visibility factor. And then my response to the kind of, this is just not possible to do, is, well, yes, it is. We have a good, solid body of evidence that says that we can construct questions on surveys that have conceptual clarity, that can capture the different dimensions of sexuality and gender identity. And finally, the final caveat, I am sort of working in the scholarly community, there's always, though, challenges, and we're all about talking about all the challenges. So I'm going to start by talking about some of these challenges. And one of them is the challenge of who do we count? So how do we count the LGBT community? I've talked about these different dimensions. Well, one of them is identity. So this is 11 population-based surveys. The first set measures sexual orientation. The last two are two surveys that ask questions about gender identity. And you see, you know, a fairly wide range of point estimates for the size for the people who self-identify as LGB in the case of most of them, and then the last two transgender identity. But nonetheless, these are all large-scale, population-based, in many cases national surveys, both the US and throughout Europe. And these questions, they were asked, they worked on the survey to the extent that, you know, they didn't create any serious problems with the methodology of the survey. We can debate what it means to have these kind of different point estimates, but nonetheless, it's possible to ask these questions of identity. A second way is to think about attraction, and another way is behavior. So in these first three bars here, these are three surveys that asked about lifetime same-sex attraction. Again, we see that you know, much larger estimates than the estimate of people who self-identified as LGB. So in the case of the NSFG, it was shy of 4%, but almost 11% who said they had a same-sex attraction. That isn't inherently a problem. We're measuring two different things, and we have different reasons why we might measure those two different things. You might, if you're interested in a study of discrimination in the workplace, you might be interested more in a sexual identity or gender identity question, because being, in some sense, to make an argument that you're being discriminated against, you can say, well, at least in some way you have had to be open about that identity. So you would want to think about identity. But if you're surveying youth, for instance, many of whom have never had sex, or who are in lots of kind of flux about how they, or even uncomfortableness about how they might identify themselves, attraction might be the better way to capture it. And a third way, if you're doing a study of HIV risk, you might want to think more about sexual behavior, because that becomes the kind of mechanism through which you think the risk around HIV is working. And so there's three estimates of same-sex sexual behavior. But it's not problematic that there's three different ways to look at this. It's just there are three different ways. And we need to think carefully about what way we select in thinking about measuring the LGBT community. But what I will say is that certainly in the latter part of my career, or sort of somewhat different from the very earliest part of my career, I am now very careful about the terms I use. So I would never call those people who acknowledge attraction or behavior lesbian, gay, or bisexual. It's up to them how they identify. I only call LGBT people who self-identify as LGBT. That's my standard, but it's problematic because we don't have language then for what these other people are. And in truth, they don't necessarily have an identity associated with that attraction or that behavior. So it becomes a kind of language problem as well. But again, that doesn't mean that we can't continue to have that clarity about how we're conceptualizing sexual orientation or gender identity.